I'm one of the staunchest followers of Ayurveda possible, and I think the belief has come from my own journey to cure my own disease. I'm suffering from rheumatoid arthritis.
I have a very hard illness, and then Dr. Krumpas, my doctor, brought me here to the Ayurveda. I had water in my feet, thick water, and pains all over.
I've been trying these Ayurvedic treatments for the last 3 years now. Ever since I had an attack of a pancreas infection, actually, about 3 years ago.
Before I came to this institution, I knew a little bit about Ayurveda. Basically because I have a skin issue, so it's called psoriasis, similar to eczema.
And recently I had a stroke with weakness to my right hand. The allopathic treatment come to an end where they could not give me anymore.
When I had a labrum tear, when everybody said I need to do a surgery, I will be off cricket for 6 to 7 months. I came here and I missed the test series in Australia, and I had to take a decision between a surgery or come back to Ayurvedic.
And when I began, from the first moment on, everything goes to be better. I found my soul, the water out of my feet went out, the pains left me, and so I came back to the normality and I can handle everything very good.
I could move my fingers, I could do my own work. In about 3 treatments, which is about 3 years, I was 95% fit.
She came to us with very severe pain in both knees actually, and now I'm seeing her already 6 months after the end of the active trial treatment, and she's symptom-free regarding her knees. So, you know, this is not me or my team, it's Ayurveda that is working, and it's fantastically working.
But then now I'm finding a little bit more belief in it because it's true, because it's a very organic way of reacting with your body. Like, I mean, people have had the system for years and years put together. They're not fools, right?
So it is not that you expect them to give you things which are about 5,000 years old. They give you things which are 5,000 years old along with the 21st century.
Ayurveda is the science of 21st century. Ayurveda is actually futuristic medicine. Ayurveda is not a medicine of past at all.
In my opinion, everything starts from the mind, in any case, you know. So we cannot ignore it, and I would say 20% of diseases should be treated by modern medicine, and the remaining by Ayurveda and all the 100 other systems that also exist.
The allopathic medicine and these ancient medicine combinedly, I think, can be immense benefit to humanity.
Por 100 otoños que veamos, por 100 otoños que vivamos, por 100 otoños que conozcamos, por 100 otoños que nos elevemos, por 100 otoños que avancemos, por 100 otoños que podamos ser, por 100 otoños que seamos, por 100 otoños que seamos. El Rigveda consta de 3 aspectos conocidos como Trisutras de Ayurveda. En la segunda y tercera Veda, la Veda Sam y Ayurveda, cantar mantras y el rendimiento de los rituales fueron respectivamente lo que se ocupa. En Veda cuarto, el Atharva Veda, el Ayurveda es un Upveda o subsección.
To understand this, you need to realize that the Vedas actually represent a psychological process of the human mind. The first three Vedas, the Rik, Yajus and the Sama, represent three powers of the human mind. That is the power of knowledge, the power of action and the power of will. So they are together known as the Trayi. Now Atharva Veda is the fourth Veda. It is the Veda of compensation, of rectification, of correction. When the harmony between your knowledge, the action and the will is disturbed, you have to forcefully bring it back into harmony. The fourth Veda or the Atharva Veda therefore represents that, re-establishment of the harmony. In a similar way, from the ritualistic portions of the Atharva Veda, the more empirico-rational, intellectual expression of Ayurveda emerged. This is very specifically mentioned in one of the Ayurvedic texts called Kashyapa Samhita, which says, such a prag Atharva Veda Upanishatsu prag utpanna, that it first originated in the Upanishadic portion of the Atharva Veda.
La literatura ayurvédica se basa en la filosofía que se llama Sankhya, que significa conocer la verdad. Rishi Kapila ha descubierto 24 principios o elementos del universo. Prakriti, la energía femenina, crea todas las formas del universo, mientras que Purusha, la energía masculina, es el testimonio de esta creación. Purusha, la energía masculina, representa la conciencia latente. Prakriti es la hembra energía creativa. En el estado trascendental están en armonía con otros. Prakriti, la naturaleza, juega el papel principal a manifestar como 10 mantras o 5 sentidos, la esencia de la vida, Panchtatras, los 5 elementos manifestados como el éter, aire, fuego, tierra y agua, y el Panchamubhutas, los 5 sutiles elementos inherentes a los 5 elementos manifestados. Cuando se lleva la creación, la primera de manifestar es Mahad, la gran mente. Este Mahad tiene 4 componentes: Ahamkara, el ego; Chitta, los recuerdos; Buddhi, la lógica; y el intelecto, Manas, la capacidad de reflexionar. Todo este espectro de la creación está regida por las trigunas, que representan la naturaleza intrínseca de Tamas, Rajas y Sattva. Las trigunas controlan el comportamiento de cuerpo, mente, emociones y también el espíritu. Central de ciencia de la curación es la doctrina del Tridosha, las energías vitales de Vata, Pitta y Kapha.
Beautiful aspects of Ayurveda is its Tridosha Siddhanta or the Tridosha principle, based on which everything in Ayurveda works. We say in Ayurveda that a Vaidya should be dosha egadrik. He should see doshas in everything, in human being, in the plants kingdom, in the things which are immovable, everything a Vaidya should start seeing doshas. And Vata, Pitta and Kapha, the 3 doshas which govern the entire universe according to Ayurveda. And what is these 3 doshas? 3 doshas are nothing but a recombination in biological system by the different elements which we call as Panchamahabhutas. Dharma, Artha, Kama, Mokshanam, Arogyam, Moolamuttamam. Rogas tasya abhartara, Shreyaso Jivadasya. This is the ultimate objective of Ayurveda. Ayurveda says that body is important, but body is not the only thing that is important. Body is important because body is the seat for your mind, and mind and body together become seat for your consciousness. If you want to improve your consciousness, which is translated into Atma in our time, Atma needs a good, sound seating place. That is the body and mind.
Alrededor de 1500 a.C., Ayurveda fue delineado en dos escuelas distintas: Atreya, la escuela de los médicos, y Dhanvantri, la escuela de cirujanos. Charaka, quien fue el médico del corte del famoso rey Kanishka, siguió la escuela Atreya de médicos. Sushruta se celebra como el padre de la cirugía. De hecho, estas dos escuelas de pensamiento llevó a la redacción de dos de sus principales libros sobre Ayurveda de Charaka Samhita y Sushruta Samhita.
Ayurvedo Amrudanam. This is the rhyme from Veda, which means that Ayurveda is nothing but for longevity. And Charaka says Ayurveda has no starting, no ending. It is Anadan and Anadi, which means the knowledge of Ayurveda has been remaining in the universe all the time to come. In that way, the Ayurveda came into literary existence through samhitas like Charaka, Sushruta and Vagpada some 3000 years back. The today's Charaka Samhita, which we consider as our basis of Ayurvedic knowledge, is actually a culmination of knowledge generated by Atreya, Punarvasu, then by Agnivesha and others.
Señor Dhanvantri, el guía salvia de la medicina ayurvédica, se dice que se es un avatar de Vishnu. Hay 4 grandes templos de Dhanvantri en Kerala, de que Trisur Neluvea en Destreso es el más grande.
It is believed that this idol installed here is placed here by Ashwini Devas. And the Lord Dhanvantri, it is believed that in his one hand he holds leech and another hand the pot of nectar. So it is a symbol of surgery. And it is Kodambu, that is the pot of nectar, that is a symbol of medicine. Every Dhanvantri temple there will be some doctors. These are medical students, when they complete their courses, they will come here and take bhajan here for 1 week, 21 days, etc. And you know that some offerings in this here. One offering is Mukdi Nivedyam. It is medicine. We call it decoctioned kashayam. That you have to take for all stomach disorders.
What is unique about India is that India has one of the richest biodiversities, also an equally rich knowledge of how to use this biodiversity for preserving and promoting human health. This combination is what makes India very unique. And here we find the medical knowledge, actually we can find it in all stages of evolution, right from tribal medicine to folklore medicine to village medicine to the more learned or sophisticated codified traditions, what we call as classical Ayurveda. This is very interesting because the ancient propounders of Ayurveda were very humble, and they said that we have to learn from nature. You know, the first lessons in healthcare are learnt by observing animals. You can find the Atharva Veda saying that the medicines that the mongoose knows, the medicines that the eagle knows, let that come to me for help. So from observing animal life to, you know, tribal situations, how tribal healers, how they discover medicine, everything was accounted. What the classical stream did was to continuously refine, modify and validate these healthcare practices. And there, what was validated became the classical stream. And what remained in the people became the folk stream.
Entre el siglo XIII y XVII, un ambiente fértil intelectual fue desarrollado alrededor de los templos de Kerala. La cultura ashtavedya ha evolucionado en este entorno, combinando el ayurveda de Ashtagandhram con los conocimientos y las prácticas de los sanadores locales. Según la tradición, inicialmente 18 castas de las familias superiores de Kerala fueron designados como Ashtavedya, que son maestros de las 8 ramas del Ayurveda mencionado en textos clásicos.
In the state of Kerala, Ayurveda was existing in a very specialized way. There were specialist pediatricians, specialist surgeons, and then we had also the Vishavaidyas who were specialized in snake poison healing. So this person was bitten by a snake. Even today in modern toxicology, it's quite a challenge to decide what type of snake has bitten. Even if it's a poisonous snake, the real challenge is to find out whether envenomation has happened. They have a linctus, which is actually a kind of paste made of various herbs, and they apply it on a betel leaf and ask the patient to chew it. Like if it is sweet taste, then they say that it is crate. If it is cobra, the patient will feel a pungent taste. And if it is viper, the patient will feel a sour taste.
Earlier medicine was an art, and art means that, and science was a very important tool of this art, right? And since we are following science, we make it very mechanized and rules and controllable. How can you control art? An artist has his own creativity and this and that, So in science we deal with diseases, which is deadly. In art we deal with life, which is healthy.
En Ayurveda, el concepto de diagnóstico implica una vigilancia del momento al momento de las interacciones entre el orden o la salud y trastorno o enfermedad del cuerpo.
Darshana, sparsana, prasnai. That sparsana, darshana means looking at a patient with the eye of Ayurveda, not merely looking at. And sparsanam is touching the body and understand the texture, tonicity, all those things is sparsana. Prasnam is interpreting that understanding by asking questions which is leading to that person, so that we can get explanation of each of these conditions.
A pesar de la falta de apoyo durante el dominio británico, muchos colegios que enseñan Ayurveda se establecieron en India. Uno de los primeros colegios fue el Ayurveda College en la Universidad de Banaras hindú. Fue creado por Madan Mohan Malviya en 1927 en Varanasi, que también fue el lugar de nacimiento de Sushruta, el padre de la cirugía. Su tratado, el Sushruta Samhita, discutido en detalle cómo realizar prótesis de la cirugía para reemplazar las extremidades, la cirugía estética de la nariz y otras partes del cuerpo.
Practice of surgery during Sushruta's period was at its peak. In rhinoplasty, the same technique even today is used as a forehead flap for reconstruction of damaged nose. The skin flap is taken from the forehead. The forehead flap is marked, which is in black. This skin flap is rotated over the nose and the reconstruction is done to create a new nose in case of a damaged nose.
Sushruta habla acerca de 125 instrumentos quirúrgicos utilizados por él. Ya la mayoría están hechos de piedra, madera y otros materiales naturales. Los dos tipos de instrumentos como la contundente o yantra y el brusco o sastra.
Ever since the inception of this institution, and what we are trying to establish is that Ayurveda has a viable model of mental health. Sankhyas believe that people cannot apprehend the true nature of the things. So, for example, to say in the most simplistic way, if I see a person, I see my version of the person. The concept of mind, the concept of behavior, and concept of personality, concept of emotions, these are all based on tridoshas. Tridosha is the fundamental biological units of body and mind. If you want to treat this, you have to use pharmacological agents to counter this imbalance in the tridoshas.
And I worked with patients of Parkinson's disease. It was an experience with a very steep learning curve, because I interacted with neurologists, with basic neuroscientists, as also with Vaidyas, and I used an intervention of Panchakarma called Basti, and it was very interesting to find that aspects that are not addressed by modern medicine in patients of Parkinson's disease are helped and benefited by Ayurvedic interventions. For example, non-motor symptoms of sleep dysfunction, of constipation, of smell, of speech, of anxiety. It initiated yet another step of how are we really going to marry these two systems for the benefit of the patient in diverse disease conditions.
All these diseases are originated because of the body's imbalance. The Ayurveda says how it can correct the body's imbalances by two methods. One is the pacification method, Shamana Chikitsa. Second one is the purification method. The purificatory method is Shodhana Chikitsa, the famous Panchakarma, which we do in almost all good authentic Ayurvedic hospitals.
En la medicina ayurvédica, la práctica de Panchakarma es una manera terapéutica de eliminar elementos tóxicos del cuerpo. Durante el masaje con aceites calientes herbales con la mano, el cuerpo es detoxificado a través de piel. En el Ayurveda, este tratamiento de aceites se llama snehana. El tratamiento de svedana podría ocasionar en la transpiración del paciente. El ritmo del tratamiento, así como la aplicación de aceites medicinales y ghees, especialmente ajustado a la constitución de cada individuo. Un tratamiento exitoso de Panchakarma ayuda a la eliminación de toxinas del cuerpo, y el yoga lleva al hombre a su estado natural de tranquilidad, que es equilibrio.
Ayurveda complements yoga and yoga complements Ayurveda. Ayurveda gives more importance to physical purification and the seat of mind, whereas yoga directly interacts with the mind and its action in the body. We say in yoga, chale vade chalam chittam nischale nischalam bhavet. If the mind is in tranquility, the vada principle in the body will be also in balance.
Ayurveda y el yoga son hermanas de ciencia. El padre del yoga, Patanjali, describió las 8 extremidades del yoga y prácticas de yoga. Estos son las regulaciones naturales del sistema nervioso, disciplina, limpieza, posturas, concentración, la contemplación, el despertamiento de la conciencia y el estado de equilibrio perfecto. Ayurveda indica qué tipo de yoga es adecuado para cada persona, según su constitución particular.
Most of the modern illnesses, because modern medicine has eliminated many of the infectious diseases, the overall living conditions have improved, but these diseases, what we call as the lifestyle disorders, are really going to be the problem of the future. In the long run, diabetes creates a lot of complications. I mean, when you look at diabetes, it's not just the high blood sugar that you have to control by popping a pill. I mean, diabetes is the precursor for so many serious conditions like diabetes retinopathy, cardiovascular disease, kidney damage, nerve damage, as they call as diabetic neuropathy. And one of the strong areas of Ayurveda is, interventions that can prevent diabetes from going into these complications.
All of a sudden we wake up in the morning and we discover that something is wrong. We go to doctor and we notice that after checking blood, our blood sugar is high. And we are labeled as diabetes. But this doesn't happen overnight. It is a sequential process. Modern science or modern medicine, we have no clue how it happens in a sequential manner. Ayurveda tells us that there are 6 stages called Shat Kriya Kal. These 6 stages tell us that how disease progresses from first stage to next stage to next stage to finally getting expressed as a disease like in diabetes.
First, the imbalance happens, say, in one dosha. Okay, then this dosha will accumulate. That's stage 1. After that, it sort of gets into a state of agitation. That's stage 2. Stage 3 is that it spreads into the body. Stage 4, it goes into a vulnerable area. Up to this point, Ayurveda can actually reverse everything. Because stage 5 is the manifestation of disease, stage 6 is a manifestation of complications. So an Ayurvedic physician, when he is looking at you, he is actually being able to recognize you at each stage, so that the disease can actually be reversed, the cause can actually be taken away.
Shuklastavaste janmado visheneva vishakrimehi taishcha tisra prakritiyo hinamathyotama pradak. This is what Vagbhuta says about Prakriti. And this Prakriti is actually the most modern concept of modern science. This talks about these genotypes, phenotypes, etc. And even today there are talks about medicine dosage form suiting to the personality type. They say that pharmacogenomics is nothing but pharmacy or medicine which suits a particular genotypic or phenotypic person.
Pharmacogenomics actually understands that different people have different genetic makeup and therefore they will need different kinds of treatments. Now, but modern medicine and modern science have no clue how to stratify or how to classify people into different categories so that a different set of people can get different medicines.
Everything in medicine is expensive, including the doctor who you see, the consultation, and the doctor then puts himself in a very fancy clinic and a fancy hospital, which is also expensive, so he has to take care of those expenses. Then the machines are expensive, the medicines are horribly expensive. All the multinationals that are putting drugs in, actually the actual cost of medicine is very small, but the duties and everything, that they bring it up to a large level because they have to take care of their research costs,
Contemporary Ayurveda consists of proprietary Ayurvedic formulations that are validated by modern science. In early 30s, there was no medicine that brought down blood pressure. There was no antihypertensive medicine. The only way to bring down blood pressure was to drain blood. So the first antihypertensive product given to the world was given by the founder of Himalaya Drug Company. It was made from the root of a plant called Rauwolfia serpentina. Subsequently, Seba extracted the active principle or the chemical that was responsible for bringing down blood pressure, and that chemical was called rezapine.
Modern medicine is based on 3 things. Either we use poison to poison the bacteria or the cells, or we use surgery to cut out things, or we use radiation to radiate the tissue, right? Now, they are effective most of the time, but they are very invasive and they are very expensive. So that is the good and bad of modern medicine. If we take Ayurveda the way it has been known, or all the herbal medicines, and there are people in government institutions and privately who have actually done the pharmacopoeia on herbal medicine, that we apply modern scientific techniques to herbal medicine and try to make an amalgam between the two, not only as complementary but as a fusion. That I think that there is room to fuse modern medicine and herbal medicine to achieve two things. One, that your therapies will be equally good or more effective. Two, they will be imminently more human friendly, so that you don't have to cut out the body or you don't have to use X-ray and all that. And third, it would be half the price.
Así que progresamos en el siglo XXI. Puede decir realmente que la medicina ayurvédica ha llegado a ser global, ganando interés internacional y el respeto como un medio alternativo de cuidado de salud física y mental.
I've had a long experience of allopathic medicine, and I have seen the limits of our treatments, especially in a normal, let's say in a general practitioner practice, because you can see that many diseases are due to the fact that people really don't take care of their bodies and their minds. So I was very lucky to be able to enroll in a very good school in Milan, which is a 4-year program, an introduction to Ayurvedic medicine. And we do our internship here in Kerala, in Thrissur, which is every year a very interesting and profound experience.
We are here also because the technique is nothing without the real knowledge. The real knowledge is connected with the cognitive process and the way people think. And since our body, as Ayurveda teaches, is not a system of organs, but is a system of relationship, we come here to modify our way of thinking, and in such a way that we can deeply understand Ayurveda. So what we are trying to do is to reach the deepest meaning of Ayurveda in such a way that we are able to bring it back to our country and to find the root of Ayurveda in our country. Because, as I said, Ayurveda is universal, it's not local.
Hoy en día, uno de los más antiguos sistemas médicos del mundo y practicado continuamente, busca su lugar en el mundo moderno. La globalización del Ayurveda, sin embargo, no es solo debido a las faltas de la medicina occidental y los efectos prejudiciales de la terapia con fármacos, más bien es el resultado de patrones sociales cambiantes. Hay una tendencia de ver los sistemas médicos acerca de la naturaleza. Es una forma humana de medicina. En países como Estados Unidos, Alemania, Francia y el Reino Unido, el Ayurveda es practicado por los médicos. En la medicina occidental, el Ayurveda es clasificado como un sistema de medicina complementaria y alternativa.
Germany is dominated by modern Western medicine, what we call allopathy in India. So any alternative therapy in Germany has problems to establish itself, to get well known. We do it, but I mean, one of the first things is that all of us, all the doctors working here, have to be Western, what in India we call MBBS doctors. They have to be Western medical doctors, because otherwise in Germany you don't get a license to practice. You're just not allowed to practice on patients. The Ayurveda Clinic Kassel is a clinical hospital department in Germany where we can practice Ayurvedic medicine. One of the unique features of this department is that we are part of a hospital, of a larger German hospital. The whole hospital has about 350 beds. Out of these 350 beds, the Ayurvedic department has a ward of 30 beds. It has a large therapy section where oil and sweating therapies are done. And in addition, the third one is the Ayurvedic department has its own kitchen and its own dining hall, which is separate from the hospital dining hall. Food is very important, how they should adapt their food, how they should use their food. And it's not that the food has to be Indian necessarily. Everything that grows in Germany and is part of the German food can be used, but it has to be used in context of the patient, in context of the disease, in context of the season.
I see why our medical doctors are coming to our training. They're coming because they have lost their dharma, as you say. You know, They once studied medicine because they wanted to do something for humanity. Then they ended up in the technical medicine. Now they're coming to our trainings in Ayurvedic medicine because they're finding back back to their own profession, and they're finding back to their own mission in life they want to share. And same with the patients. The patients in the moment coming to Ayurveda, they need to have a doctor having time to really understand their problems.
Ayurveda in Germany is mostly known as a wellness system, and people don't know it's a medical system. And what I feel is a big problem, it's not accepted by the government as a medical system. So it's not covered by the health insurance. And German patients are used to having everything covered by health insurance, so they're not used to paying for medical care. And that is actually one of the main problems in Ayurveda, I would say, because actually it's not expensive, but people are not used to pay for their health.
The first insurance company in Germany just recently had a discussion with me how to build up a framework to implement Ayurveda in their portfolio. The European Society for Quality in Healthcare just recently opened a department for Ayurveda and complementary medicine. Then the universities are now taking up also research, and when you see all that, then you can be assured that Ayurveda has a great future in our countries.
El éxito al uso de Ayurveda en el occidental se deriva en la gran medida de la capacidad para adaptarse al módulo alopático occidental. El Ayurveda trabaja junto con la alopatía en muchos hospitales.
Germany is not the same as India, or Europe is not the same as India. We have a different climate, we have different nutrition habits, we have some different genes. So what's also of interest, of much interest, is we have to adapt a little bit to the European or to the American conditions. Perhaps not everything is the same. Perhaps a treatment that works in Mumbai or in Delhi very well will happen to be adapted a little bit in Berlin or in New York City. We started now with within the frame of our cooperation, also with the Indian government, about which we are very thankful. We started to treat patients now. We are sure that we will have some good results, and then we will start to implement it into the European healthcare system.
Trambakam yajamahe sugandhim pushtivardhanam urvarugamiva bandhanan mrityormukshiya mamritato. What we see today in Western countries and also globally is a trend towards integration, towards integrative medicine. And for our understanding in the universitarian setup, that does not mean a sort of random integration of therapeutic elements, but it means the integration of the best possible therapeutic tools for our individual patients out of the mixture of different therapeutic modes. If I have a patient here in the hospital who comes with a certain disease, a certain health problem, a certain health condition, that we take elements from different systems of medicine. Suppose we have a patient who comes in with rheumatoid arthritis or osteoarthritis of the knee, so joint and bone disorders, and asks us for help or for our medical advice. This patient will of course also receive Ayurvedic treatment, Abhyanga, Swedana, maybe some Ayurvedic herbal treatments. And we will also take advice from our yoga specialists who will then come and see which joints are affected, and he will give us advice on certain yogasanas which might be beneficial.
Ayurveda puede trabajar para complementar a otros sistemas de medicina. contrarrestar los efectos adversos de la medicina convencional y acelerar la fase de recuperación.
I'm a gynecologist and an obstetrician, so I tried to find holistic concepts for the treatment in gynecology and obstetrics. We deal with pregnant women like with patients, and this is wrong. But we can help them to have a good pregnancy, to have a good time, using also these techniques of natural herbs, of meditation, of yoga during pregnancies. Also, we start to teach the mothers to apply Ayurvedic massage to their newborn babies every day. This moment they start with the massage, the babies are very quiet, very relaxed, and this is, I think, a very important and pleasant atmosphere.
Ayurveda es una forma de medicina holística que se parece mucho a las tradiciones médicas europeas. Por lo tanto, los europeos han encontrado una creciente aceptación de este antiguo sistema de salud, de bienestar y equilibrio como medio de curación, mantenimiento de la salud y prevención de la enfermedad.
I'm working as a general doctor in the countryside, as a family doctor, and I think that there are many illnesses where the normal medicine has no solution. So I'm just working for the last few years together with my husband, and if there are some cases where we don't find any solutions, I just ask him to help us with Ayurveda.
The development of Ayurveda in Europe is, I think, really something which will be a type of pioneer work now, because it's not here at the moment. Wellness Ayurveda is here, but medical Ayurveda only a few doctors do. As you've been to the Charité in Berlin, Castle Clinic, in Germany there's more development. I'm one of the few doctors in Austria who are doing really with the medical tradition. And I think that's also an interesting point of view, to develop Ayurveda, be on the first front and change things to something better.
Ayurveda continúa a crecer rápidamente como uno de los sistemas importantes de la mente, el cuerpo, medicina y la curación natural. Con la necesidad de terapias naturales, de la prevención de enfermedades y el acceso espiritual a la vida se hace muy importante en esta época ecológica.
See, the mindset that is expected of a Vaidya is not as a profession but as a service. That to the extent that one should be able to treat a patient as his own son, his own child. If your karmas, if your work that you are doing is conducive for these two, Shreyas and Prayas, you are a good human being. That is the purpose of life.
Por 100 otoños, que veamos. Por 100 otoños que vivamos. Por 100 otoños que conozcamos. Por 100 otoños que nos elevemos.